Who is winning the vaccine diplomacy battle? COVID-19 was officially declared a pandemic a year ago, and since then, it has claimed nearly 3 million lives. For the past year, nearly every major drug company has been working on a vaccine, and now they're getting into people's arms in record time. But unlike the coronavirus, which has arrived in nearly every country, the vaccine has not.
Just 10 countries have administered 75% of all COVID-19 vaccines. Meanwhile, more than 130 countries had not received a single dose.
With a growing number of vaccines getting approved each day, wealthy countries are increasing their stockpiles.
Leading companies such as Pfizer, Moderna and AstraZeneca have signed deals with the EU, the US and the UK. Other high-income states such as Japan and South Korea have placed orders with these firms, though they have yet to receive their shipments.
Many rich countries have placed orders that far outnumber their populations. Canada, for example, could vaccinate each Canadian 5 times over, and the EU has more than enough to go around.
In a couple of months in Europe, we will have more doses than we can use.
All the while, poorer nations are struggling to secure any. The head of the World Health Organization condemned what he called vaccine nationalism.
Vaccine nationalism might serve short-term political goals, but it's ultimately short-sighted and self-defeating.
With the US absent from the world stage and Europe looking inwards, countries unable to secure a vaccine have been turning elsewhere.
Russia and China say they'll send their vaccines around the world.
President Putin surprised the world last August, announcing Sputnik V had been given regulatory approval.
India is distributing millions of doses in its neighborhood and further afield.
Russia, China, and India are actively promoting their vaccines abroad and filling a vacuum left by the West. Tired of waiting on the EU, the bloc's closest neighbors are turning to others for help. Russia and China are already gaining ground and influence in the Balkans, supplying them with millions of doses. Sputnik V is also making its way to the US's backyard, Latin America.
Rusia, bajo el liderazgo del presidente Vladimir Putin, trae nuevamente alivio al mundo.
Both of China's vaccines are making their way around much of the world. They're part of what's being dubbed the new Health Silk Road, with pledges of nearly 500 million doses to more than 45 countries. And the Kremlin says it has received requests for 2.4 billion doses from over 50 nations. And India, the world's biggest vaccine maker, is using inoculations to strengthen its regional ties and counter Chinese influence.
The goodwill gesture won praise from neighbors such as Bangladesh.
A friend in need is a friend indeed.
Indian Prime Minister Narendra Modi has emphasized that neighboring countries will be prioritized in the distribution of vaccine supplies.
But many Western drug makers have preferred going through multinational agreements like the WHO's COVAX. It's a program designed to ensure fair distribution of vaccines to the world's poorest nations. But it's been weakened by bilateral deals rich nations have been making.
Governments are under pressure to secure supplies for their populations. If governments compete for vaccines, most countries could miss out. This is not only bad for countries that cannot secure their own supplies. It's bad for us all, as no one is safe until everyone is safe.
For decades, the West had led the global health fight with their generous donations. But now, new countries are stepping up to fill a void brought on by the pandemic. Vaccines have become the latest diplomatic tool to win hearts and minds. And as of now, it seems the West is losing that battle.